Welcome to Full Circle. I'm Suzanne McAllister. Thanks for joining us today. We have a terrific program lined up for you today. We're going to show a DVD called The Chronicles of a Dead Man, and it will definitely affect what you think about in the afterlife. And here to tell us about his general dentistry practice as well as his cosmetic dentistry practice, we have Dr. George Kirtley. Dr. Kirtley is based in Indianapolis, and it's our pleasure to have him on the program today.
Thank you, Suzanne.
And I want to mention for the folks at home that you have been my dentist now for probably 20-some years, and I want to thank you for coming on the program.
My pleasure. Thank you for having me.
So I sort of mentioned a little bit about your practice, but how do you describe your practice?
I have a family practice, a general practice, as oftentimes it's termed, and but there's a kind of a specialty area or an area of expertise that I've attained in the area of aesthetic restorative dentistry, or as it's more commonly known as cosmetic restorative dentistry.
So when we hear that, many people think, oh, that's just dentistry for those that are very vain.
Yes.
Not the case, right?
No, not always the case. It does cater to the vanity, for sure. And I think in our society, Western culture, it's we like to look young for a long time.
Exactly.
And the smile can certainly contribute to that.
But you do actually, because of trauma, disease, impact, you actually help restore people's smiles as well, don't you?
Yes, and it's probably, you know, it's not the bigger part of what I do, but I've had the blessing to work with a number of surgeons and with patients who have been disfigured through disease in the way of cancer, people who have been traumatized through injury within the mouth, their teeth. And so those things are a byproduct of my learning and my opportunity to really get a degree of fulfillment that is even beyond what I get when just doing it for the vanity-driven reasons.
Yeah, absolutely. And I know that you do teach and lecture all around the world, so we are so fortunate to have you here.
Well, thanks.
Well, you know, this show's geared to baby boomers,
Yes.
and many of us are dealing with issues with our teeth. Are there some common things that happen to our teeth as we age?
Yes, there are. Certainly wear is it, and most of the patients that I do see are coming to me as a result of just simple wear and breakdown. The advent of fluoride in the 50s, 60s has certainly impacted the amount of tooth loss and breakdown that we see as a result of decay. So it's now become an issue as I get into treatment of patients in the 40, 50 year, 60 year, or even more older age groups, that most of what I see is the result of just simple wear.
Sure. So as our hips and our knees give out, so do our teeth.
As do the teeth.
Yeah, absolutely. We have a series of pictures, clients of yours who have had some issues. We have some before and afters. You mentioned age-related issues. I think in this first slide is something that is reflective of that.
Yes.
So tell me a little bit about the process of how you go about the before and the after.
In my practice, how I do this is generally a patient will come expressing a desire to beautify their smile. But what I'm first most concerned about is the reasons why it got to the condition that it did. And so our regimen of treatment and diagnosis is that I take a lot of photographs and do, of course, a very thorough exam, and it's from this that we determine the direction we're going to take. We also have the capability of enabling the patient to kind of get a preview of what their smile will look like after we finish through the use of computer technology in the way of a software, which I was a part of the development of, called Envision a Smile.
Huh, and that's why your website is called Smiles by George.
Correct.
Let's go to the second set of slides. This individual had quite a bit of misalignment. Is that common?
Certainly it can be. You know, a lot of the patients here that are in this particular patient that you see was an older patient and probably didn't have the benefit of orthodontic treatment as we have had throughout our life. And so in addition to that, there's a significant amount of discoloration. So there were a number of things that we were trying to correct. Alignment is one, improvement of the shade of the teeth is the other. And the unseen thing, which is really the most important thing, is the ability to put together something that functions properly and doesn't degrade after we complete the process of restoration.
Sure, and very briefly in this last slide, this is an example of a patient that, quite frankly, just got bad dental work previous to coming to you.
Yes.
Is that a common issue that you have to correct?
Well, I do restore a lot of dentistry that has been previously done. And is that a result of injudicious care, or is it a result of the doctor, or is it injudicious care of the patient? So, yeah, I never really know the full story of that, but I do get to redo a lot of dentistry, and a lot of that is simply driven by the patient not being happy with how it looks, and so they come and we make the plan to rectify it.
Well, and certainly you have done such a good job for me, and I appreciate that. We're going to take.
You were easy.
Oh, thanks. We're going to take a break, though. You know, at the top of the show, I mentioned that we're going to see a video called "The Chronicles of a Dead Man." Well, actually, Dr. Kirtley wrote the short story, and now it's a DVD. So we're going to explore the other side of his life. Stay with us. Welcome back to Full Circle. We're continuing our conversation with Dr. George Kirtley. He is a dentist here in Indianapolis, but he's also an individual with a very creative side. Not that being a dentist isn't creative, but he wrote a short story, and now it is a DVD. It's called The Chronicles of a Dead Man. Wow, this is a heavy subject. So why did you write this short story?
You know, actually, it was born out of my observation initially of watching a family go through the process of a dying father, and then through the process of the funeral, and after his death. And then as I began to write it, as often happens when you write things, you begin to reflect upon your own personal experiences from different parts of your life, particularly as a child. And then through the course of young adulthood and into the older years, and you know, you begin to get reflective on those things and think about those things and the spiritual part of it, and so in this story, if you would like for me to comment on that.
Sure.
In the story, this happens, and after this person passes away, he has a moment to reflect upon his life before he goes on to the place that we all desire to go. And he gets to reflect upon his life and the things that he saw and that he thought was important. He got to reflect upon his life as a father and as a husband, and to reflect upon and the thought of what am I leaving behind?
Well, that's a perfect setup. Let's take just a minute or so and watch some of the Chronicles of a Dead Man.
The smell of freshly turned soil hung motionless over the gravesite. The living stood erect, and the dead lay surprisingly still, given the disgusting display of insincerity shown. They circled the soon-to-be planted casket, justifying their greedy need by their token presence. There's nothing like it, the insatiable desire for money and things. No matter who you are, no matter what you believe in, the most righteous of thinkers will fall prey to the thoughts of getting something, especially when there are other dogs in the room. It is interesting, if not humorous, to now see how they reacted to a dying man.
Wow, Dr. Kirtley, I can imagine that many people have been moved by just that little snippet that we saw. It's certainly powerful, and the images are very powerful. You talked about how this will cause people to reflect on their lives, as it did on yours. How has this process changed your view about dying?
Well, strangely, when I wrote this story, which was about 7 years ago, and then subsequent to that have made it into a DVD. But 7 years ago, when I started that, that was prior to my father dying. It was prior to my mom being where she is, and I'm kind of living some of the same things that I wrote about, and being challenged by the same things that I wrote about. I think the essence of this really should come through as how we treat our aging.
Right.
Population and mothers and fathers, and I personally, I'm being challenged by it. I confess that it's difficult, and to have a mother that has had a stroke and has become debilitated and become reliant upon the simple things of just getting out of bed and being able to go to the restroom.
Sure.
Things that we take for granted, and to see the incredible reliance that they have on us, and then to be challenged personally, as so many people have been, far more than I, but to be challenged by the difficulties of that from a physical standpoint, and trying to structure and create an environment for them that they feel like they're worth something.
Yeah, and I think that was my takeaway in the Chronicles of a Dead Man. You talked about how people they're almost invisible. They make comments, and of course we know that the aging person can hear in many cases,
yeah.
and also the greed that's involved. We need to take a break, but we're going to continue with Dr. George Kirtley after this. Welcome back to Full Circle. We're talking about Chronicles of a Dead Man in this segment of our program. And as you've seen throughout the show, Dr. Kirtley wrote it, he narrated, and he played the dead man. How did that question some truths that you may have had now that you have played this role?
Well, it made me really think about things that I believe that everybody thinks about, but sometimes doesn't talk about. And death's a strange thing. I've seen it in a lot of different ways, as well as everyone has. I'm not unique there, but I do believe that a lot of people are reluctant to talk about it and be convicted of where they are in life, and as it nears that finish line, the things that as you grow older that you do think about and make you uncomfortable. It's a conviction about how you're living your life.
Yeah, and I was just going to say, when you do make that really sincere reflection, I know in my own life, it has changed priorities in my life and made me look at things differently. Did that happen with you as well?
Yes, it has. It's a continuing process. It seems to be speeding up in terms of those convictions. And the older I get, with my children, with my mother, my wife, and my family, and the realization that you do have just limited time, and that you want. I think it's everybody's desire, and to have this commission of leaving, knowing that you've done something for the benefit of mankind in some way.
So do you feel that there's a higher purpose in this for you and the DVD itself?
Yes, and I believe without question that this has all come to fruition, because of my faith and where I'm being directed.
So in a way, the people that made the video were brought into your life as well. That was a miracle and a blessing in and of itself.
Yeah, it's extraordinary, what I've learned and who I've met and how it came about on a shoestring of support and that it just it came together because I believe that it was supposed to come together and I didn't know anything about what I was doing for the most part, except that I had a great desire to deliver a message.
So in summary, what would that overall message be as we reflect on our lives, as we think about the afterlife?
Truth about why we are here and what directs our life.
I think that is a good place to stop. Thank you very much.
Welcome.
I'd like to thank Dr. George Kirtley. He is a dentist by day, but as we have seen, he is a very creative individual, and he is the author and the narrator and the lead in the Chronicles of a Dead Man. Thank you very much.
Thank you, Suzanne.
The contact information is up on the screen if you'd like more information about what we have been talking about in this portion of the program. But don't go away. We have an awesome performance coming up next.
Musical Showcase is brought to you by Flanner and Buchanan, helping families tell the story of their loved one's life. Musical Showcase is brought to you by Flanner and Buchanan, helping families tell the story of their loved one's life.
Welcome back to Full Circle. It's a pleasure to introduce California native singer-songwriter Richard Eichhorn. Richard, welcome to the program.
Thank you, ma'am.
Tell me the name of the song you're going to perform.
It's called Lighthouse, and it's a song that my pastor's mom really likes, and so I kind of prayed about it, and God kind of spoke it to my heart, so I decided to go ahead and do it.
All right, Richard's going to perform Lighthouse. I'm Suzanne McAllister, and I'll see you next time, Full Circle.
There's a lighthouse on the hillside that overlooks life's sea. And when I'm tossed and turned, it sends out a light that I might see. And the light that shines in the darkest night will safely lead me home. For if it wasn't for the lighthouse, this ship would be no more. Everybody that lives around us is just tear that lighthouse down. Well, the big ships don't sail this way anymore. There's no use in it being around. But then my mind goes back to that stormy night when just in time I saw the light, yes, the light from that old lighthouse that stands upon the hill. And I thank God for that shone a light all around me, that I could clearly see. For if it wasn't for the lighthouse, tell me where would this ship be?
Amen.
Closed captioning provided by Hear Hear. Hear Hear, discrete hearing solutions at affordable prices. 317-731-5386.
When doctors told me I would never walk again, somehow I knew I would. Whether you need support in a tragedy or just to make it through a bad day, prayer can make a difference. America, let's come together by believing with each other.